This medication is often used by individuals who have difficulty obtaining enough phosphorus from their diets. Phosphorus is a crucial mineral for bone health and plays a role in regulating calcium levels in the body and urine. It is important to take this medication as prescribed by your healthcare provider. The typical dosage is usually determined by your doctor and based on your individual needs. It is best to take this medication at the same time each day to maintain a consistent level in your body. When taking Wes-Phos neutral 250 mg tablet urinary acidifiers, it's important to follow your doctor's instructions. Typically, you will take this medication 4 times a day with meals and at bedtime, and be sure to drink a full glass of water with each dose. After taking the medication, try not to lie down for at least 10 minutes. Consistency is key with this medication, so try to take it at the same times each day to get the most benefit. The dosage will depend on your medical condition and how you respond to the treatment. It's important to note that you should take this medication 2 to 3 hours before or after taking any products containing magnesium, aluminum, or calcium, such as certain medications, vitamins/minerals, antacids, dairy products, and calcium-enriched juice. These products can bind with phosphate, which prevents its full absorption. Always take this medication as prescribed by your doctor. Do not increase your dose or take it more often without your doctor's approval. Side effects of Wes-Phos neutral 250 mg tablet may include nausea, vomiting, diarrhea, dizziness, or headache. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. This medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of side effects. Most people using this medication do not experience serious side effects. When you start taking this medication, there is a chance that an old kidney stone may be passed. Notify your doctor immediately if you experience any serious side effects, such as bone/joint aches, muscle cramps, stomach pain, swollen hands/legs/feet, confusion, fast/irregular heartbeat, seizures, unusual weakness, tingling/numbness of the hands/feet, or signs of kidney problems, such as changes in the amount of urine. A serious allergic reaction to this drug is rare, but seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects, contact your doctor or pharmacist. If you experience any side effects, call your doctor for medical advice. In the U.S., you may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Before taking Wes-Phos neutral 250 mg tablet urinary acidifiers, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Additionally, it's important to share your medical history with your doctor or pharmacist before using this medication. This includes any history of high phosphate, potassium, or sodium levels, adrenal gland problems, fluid retention, bone problems, heart disease, high blood pressure, kidney disease, liver disease, muscle problems, pancreatitis, late pregnancy issues, dehydration, severe burns or wounds, or if you are on a special diet. Since this medication contains sodium, it's important to consult your doctor if you are on a salt-restricted diet or if increased salt intake could worsen your condition, especially if you have heart failure. Older adults may be more sensitive to the side effects of this drug, particularly swelling in the legs and feet due to sodium and water retention. If you are pregnant, this medication should only be used if clearly needed. It's important to discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. As with any medication, it's crucial to follow your doctor's recommendations and ask any questions you may have about Wes-Phos neutral 250 mg tablet urinary acidifiers. Before taking Wes-Phos neutral 250 mg tablet urinary acidifiers, it's important to be aware of any potential drug interactions. This medication may interact with other drugs such as aspirin, burosumab, digoxin, eplerenone, high blood pressure drugs, potassium supplements/salt substitutes, vitamin products, and certain water pills. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. If your doctor has recommended low-dose aspirin for heart attack or stroke prevention, continue taking it unless instructed otherwise. As always, it's best to consult your doctor or pharmacist for more details. And remember, it's important to follow your doctor's instructions for the best time and dosage of Wes-Phos neutral 250 mg tablet urinary acidifiers. If someone has taken too much of Wes-Phos neutral 250 mg tablet urinary acidifiers and is experiencing serious symptoms like passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. Symptoms of overdose may include severe diarrhea and muscle spasms. It's important not to share this medication with others. Your doctor may recommend lab or medical tests to monitor your calcium, phosphorus, potassium, sodium levels, and kidney function while you are taking this medication. Be sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It is important to store Wes-Phos neutral 250 mg tablet urinary acidifiers at room temperature and away from heat, light, and moisture. It should not be stored in the bathroom and should be kept out of reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to dispose of it properly. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.